Hello, everyone. So today we are going to be discussing our campaign for boosting treatment of typhoid fever in Bauchi, Nigeria. Before we get started, this is our typhoid treatment team. Again, I'm Micaela Florentino.
I'm Mel Skolnick.
I'm Molly O'Brien.
I'm Pia Modala Velasa.
And I'm Mary Hyla.
So this is just a quick overview of what we'll be discussing today. Okay, so typhoid fever. So the early signs of typhoid fever are weakness, headaches, fatigue, stomach pains, and a constant fever that progressively rises. And as symptoms further progress, a rash may appear on the back of the patient, a swollen stomach may also develop, and weight loss across the body may also start to become more noticeable. Risk factors for typhoid fever are areas that lack access to clean water, lack access to proper sanitation, and have poor sewage systems. Young children are also risk factors, and specifically the rainy seasons of the year put more people at risk to typhoid fever. So if typhoid fever is not addressed, those early symptoms can turn into intestinal bleeding, paranoid psychosis, myocarditis, endocarditis, pancreatitis, meningitis, and if it continues to be untreated, death may also occur.
So the setting is in Bauchi State, Nigeria, and typhoid is among one of the most common diseases that people in Nigeria have been facing due to a lot of different environmental and socioeconomic factors, with Bauchi State being located in a typhoid endemic region. For prevalence, there are about 17.8 million typhoid cases in low and middle income countries, 7.2 million of these cases being in sub-Saharan Africa, and the prevalence of typhoid fever in Nigeria ranges from 3.9% to 18.6%. There are also lower rates of incidence in Bauchi State than compared to other regions of Africa. Ecological and socioeconomic challenges. So there are a wide range of these challenges present in Bauchi. Environmental degradation due to mass deforestation, oil spillage, water scarcity, and pollution are a few among these challenges. Nigeria also falls into the middle to low income category and therefore lacks a widespread insurance system, meaning that most people have to pay out of their pocket for healthcare services. And this also contributes to the limited access to healthcare for most people in Bauchi. Contextual characteristics. So for context, Nigeria is the most populous country in sub-Saharan Africa, and the economy in Bauchi State is heavily focused on agriculture and food production.
The social detriments of typhoid fever include contaminated water and improper sewage systems. Improper sanitation in sewage system leaves the population exposed to the bacteria, which is commonly found in feces. Personal hygiene is important as it helps prevent the bacteria from infecting you, but some may not understand its importance because they may not know where this bacteria comes from and why it makes them sick. Crowded housing also makes it easier to spread the bacteria onto one another. And lastly, due to poor sewage systems, foods commonly eaten raw, such as fruits and vegetables, are exposed to the bacteria, causing locals to consume large amounts of it.
So when designing any public health campaign, there are important considerations that have to be made in order to make the campaign a success. And one of those considerations are the cultural considerations. So for context, in Bauchi State alone, there are 55 distinct tribes or groups. And something that can come along with this is the strong traditional beliefs that may lie within some of these groups. And then one of the challenges with that becomes that when people get sick, sometimes they are more likely to go see a tribal healer than they would to a medical professional who can aid them with medication to treat their disease. And this can be quite dangerous because sometimes the remedies or the tools that these traditional healers are using can actually make the problem worse, or simply in the fact that the disease is going undiagnosed for a longer period of time, which can make the case much more complicated when if they ever do get treated for it. And some of this belief for the traditional healers comes from associating illnesses like typhoid and other symptoms with supernatural forces such as evil spirits. And then along with that, there are bioethical considerations that we have to make when designing our campaign. We have to be sure that we are cooperating with the locals in Bauchi State. We can't have an imperialistic approach where we are forcing them to do anything. We have to work as a partnership with them for education and the betterment of everybody. And it has to be with their consent. They have to be willing participants in this campaign, otherwise it won't be effective. And we have to remember that we are not trying to dismantle anybody's belief systems. We are trying to be respectful of all different cultures and beliefs of all different groups and societies within this region. And one particular case study that we feel really accomplishes these considerations and accomplish their goals was an effort by UNICEF that created a medical corps within Bauchi. So UNICEF partnered with the Bauchi State Primary Healthcare Development Agency with funding from the EU, and they went in and trained trusted community members in remote Bauchi areas to diagnose and treat common diseases in children. And they actually gave them the tools and the medications that they needed to really make a difference in those areas. This was a volunteer position, so these people are selected by their community as trusted members that people feel comfortable sending their children to. And there are 1,200 of these integrated community case management corps in Bauchi State. And we feel that this case really emphasizes the importance of trust and cooperation that we would like to emulate in our campaign.
Okay, so as a proposed intervention, we had to, think about how to work realistically with Bauchi, Nigeria, considering the fact that money isn't always abundant and that transportation can be really, really hard sometimes. So we were thinking about education, and as a person, a part of this group, I think I can agree for all of us that education has been a big, important part for our part as in terms of research and in terms of trying to get the message out there in terms of our campaign. We understand that there might be difficulties with certain things, but this is our plan. We've created a brochure that is easy to read, easy to distribute, and sparks interest. And we want to really create a conversation between people, neighbors, families, friends. We are hoping that this way of campaigning will spread word.
And as for the funding aspect of our intervention, we estimate that the printing cost for each brochure would be about 50 cents. So with $50, we could print around 100 brochures to distribute throughout Bauchi State, Nigeria. These brochures will be distributed by the LI staff and are free of cost. Due to financial constraints, only one brochure will be distributed per household. We understand and acknowledge that the brochures may not reach everyone in Bauchi, but we hope that this information spreads enough to actually make a difference.
The main takeaway today is that typhoid fever is one of the most common diseases in Nigeria, which is why it is important to recognize the symptoms of this disease as early as possible, because treatment reduces the risk of more complications. We have also made many considerations, and we aim to work with locals to help educate and bring awareness. We respect their beliefs and understand that we cannot force anything on them. Nigeria is the most populated country in Africa, and we seek to play a role in providing some resources to spread knowledge about typhoid fever and treatment in an attempt to reach the general population, giving them the information they need to take the next step.
Overall, we just want to say a big thank you to you guys being here today to listen to us talk about our campaign and our goals and our mission and our dream for Bauchi, Nigeria. Here is all of our emails that you can reach us at. And I think something that really drove all of us is our passion to help people and be a part of a really big experience, saving lives and helping to educate people. So we really, really, really appreciate you for being here today and supporting our campaign.
Yeah, sure. Congratulations, ladies, for successfully completing the program, and not just completing it, but completing it in an awesome way. Okay. I really, really love the presentation, the engagement, and it showed that you guys have done a really in-depth research regarding your topic. You know, I believe there's a saying my tutor always tells me, that anything can be improved. Anything you see, whether it's working perfectly, it can still be improved. So we already have a treatment that is working for us, but you guys discussed improvement of that treatment. Okay, so it's an amazing, amazing topic, and the way you guys presented it. I love the aspect where you mentioned the ongoing programs where they train some local non-medicals to actually help with the community. We call them CHEW. CHEW means Community Health Extension Workers. So as you know, we are short of medical professionals, nurses, and the ones that are there are overworked. So those rural areas where they don't have good road access or good hospitals, good medical care. So they train some of those volunteers to actually help them. So these people assist in deliveries, some deliveries, they assist in treating the common symptoms. So I love the fact that you guys went that deep to actually know what is going on. Well done, guys. And yes, every other thing that you mentioned was just superb. Okay, well done. And once again, congratulations. Thank you.
All right, sorry about the delay. I was struggling to unmute there. Nancy, would you like to go next?
I wanted to mention that I noticed that you branded your first slide with leadership initiatives. And so I thought that was a great way to give some credibility to the organization that you've been working with this week. All of you had excellent presentation skills. It was conversational and it didn't seem like you were reading. And so for that, I say great job. I love the brochure that you were proposing, and on the intervention slide, you had some goals of engagement or increased interest and easy to read, and I think you achieved that. And the use of color was good, and the font. So I think you were going to print 100 of those, and so I hope they will be extremely effective in what you're trying to do. Great job. I could tell that you worked really hard on this presentation, and it was engaging, and thank you.
All right, perfect. And Umar.
Well, guys, congratulations, congratulations, congratulations. I just have to keep saying congratulations. I really enjoy your presentations because you guys actually take me through a lot of details that are really, really important to me that I really, really love about your presentation. Just like Dr. Aisha, she said that you guys have done an in-depth research to get your source of information and to have like a connection with the community. It's really, really amazing because this is one of the things that makes your project to be successful. And you have like enough information to work on. And you guys considering that we have like herbal doctors who give concoction to a lot of people, it's really tricky. I like that because that's exactly what happens. So people don't like to go to the hospital or to be examined by a professional doctor. So the first thing is that uh, there is a saying we say like everyone is a doctor in Nigeria because whenever you complain that you have a headache, people will just start suggesting some drugs, some medication, some other stuff. So everyone is a doctor in Nigeria. So so that's led a lot of people to a lot of troubles. Let me tell you the fact. Considering these people, I'm bringing it into your topic. It's more or less like you're saving hundreds of lives because people are taking a lot of herbal medications, and at the end of the day, it used to affect their liver. So that's it's also a big problem. And whenever they have that situation and considering their financial status, so a lot of them actually died innocent. So bringing that to their attention, it's really, really important. And I love the way you guys just captured that. And talking about, indicating that there are people who actually help in the community, people who they can trust or who they can seek information from. It's really, really engaging. Your flyers, your infographics, it's really, really amazing. I love it. I love the way you captured everything. It's the images are really, really speaking to anybody who is listening to your presentation or anybody who get to receive your flyers. So that's something that people can actually use in order to make sure that they take preventive measures. Because you can consider that there are a lot of people that don't understand English or don't understand or don't even know how to read. But images always speak. So when people look at images, it actually tells them what you guys are talking about. So your team also discussed about the sources where you can possibly get typhoid fever. And that was exactly what people need to know. Because some people, if you look at their source of water and their sewage, it's almost like closer. And they don't know that the water actually travels from one part of the soil to the other. So it may actually contaminate their well, it may contaminate their source of water. And you guys have mentioned a lot of things like, leaving their food opens and stuff like that. This is really, really amazing. This is the information that exactly people need to know. So your presentation is a huge project. Your presentation, it's actually a strong information that it's really going to help a lot of people understand that prevention is better than cure. So you guys have nailed it. Congratulations. I love your hard work. I love your brains. Beautiful girls with beautiful brains. That makes everything perfect. So congratulations, guys. I'm really proud of you.
Perfect. Thanks, Umar. And thank you to all of the panelists for your great feedback. So congratulations to you all.